Please get your questions ready, and I'm just going to start by maybe asking, how are the results from these evaluations that many of you talked about today, how are they shared with your private and public partners, and the strategies that you use to share those evaluation results for action?
Yeah, that's a good question. So, for this particular example, but a model that we're planning to use in other cities as these kinds of things take place, this is the first one. I mean, there's two others that are likely to come out following this, but this was one of the first interventions that was supported in any of the programs. So what we have is the evaluation team actually go to the community and, as part of one of their steering committee meetings, actually sit down with them to explain the results and what they mean, both in the context of this work, but also in the context of where this fits into the larger kind of knowledge base. Some of the other strategies that we're supporting, not just for this particular partnership, but our commitment to the broader public health and public policy and urban health community, is we've made a commitment to our evaluation team at HBSA to develop a site where data can be made available for scientific request. So that's something that will be launched over the next 6 months or so, but they've been keeping that data so that when articles come out and there are questions about it or interest for further scientific inquiry, those kinds of decisions and exploration can be made.
So for the TransMilenio and TransMilenio evaluations, so for the TransMilenio, we started actually evaluating TransMilenio since the year 2011. So we have had several administrations, but independent of the administrations, we have shared those results with especially with TransMilenio, more than the private operators. And actually, when I show you the simulation that we did that shows that we should keep those stations like 600 meters apart, they have that within their plan and within the decree that they have for TransMilenio. So now they added an additional justification for those amount of meters, which is health. It's not the most important one, but at least it's another argument that they have for having their stations that apart. That's for TransMilenio. Then for TransMicable, which is our new evaluation, and I didn't show that here, we actually met with the operators, both, and also with TransMilenio, and we built the conceptual framework using the group modeling building approach that Anna showed this morning. So we have, even for the beginning, for our framework, how they think that possible health effects and transport effects can be related with the new implementation of the system.
We're still in a very preliminary stage, but
That's not on yet.
I'm sorry. We're still in a very preliminary stage because this was just published, but one of the things that has to happen, I think, in order to build political will is grassroots involvement. And I think that begins in developed countries like the United States, and that we're responsible for a huge proportion of greenhouse gas emissions and environmental degradation. And I think that in order to build the political will, we really need to mobilize at the grassroots level. There's not been a social movement which has started at the federal or even state level. But what I came away from this process with was a new sense of urgency, that we really don't have a lot of time to reverse this process, and that this syndemic has the promise of addressing 3 major pandemics simultaneously.
Thank you very much. Any other questions from the forum members? Yes, please go ahead.
Sure, just Andy Wilson from PATH. Just to pick up on what you just said, you commented that it had to start in the developed world. But if you look at, like, Vietnam was an outlier very desperately, the habits are just forming in those countries. Doesn't it have to start there now? Can we wait for the developed world to build advocacy and it to flow down the food chain, if you will?
That's a good question. I mean, so the problem is what's not to like about ultra-processed foods? They're readily available. They're cheap. They have a long shelf life, and they have a very powerful lobby behind them, and very influential on government. So I don't know. I mean, I think we need experience in low and middle income countries, and we need to share these data with policymakers in those countries. Because we've been working on obesity for years, it's clear that most health systems in low and middle income countries are not prepared for the consequences of obesity, the type 2 diabetes with its blindness, amputations, renal failure, the cancers that are coming, the cardiovascular disease that's coming. And furthermore, obesity is not necessarily a negative in those countries. In fact, in South Africa, for example, increased body size is valued because it indicates that that person does not have HIV/AIDS. So there's both a communication and risk communication strategy to ultimately get to the kind of policies that would allow a country like Vietnam to tax sugary drinks. I mean, Latin America is already there, and it's probably the most progressive place in the world where governments are addressing particularly the epidemic of obesity. Mexico, Chile, a number of countries now have either passed or are passing sugary drink taxes, which is the first step. But a country like Vietnam, I'm less certain about. I think that's the challenge.
Please go ahead.
Hi, Allison. Just very quickly, I remember studying in health communication the idea of gain framing and loss framing when it came to communicating with addiction-prone or people that are sort of more on the edge of like driving drunk or things of that sort. I was going to ask, just in terms of the types of interventions you're establishing and the research that you're doing, what sorts of communications tactics do you use with these people?
That's a great question. So one of the strategies that we are encouraging in each of the programs is using social marketing approaches, but also broader communication channels to reinforce not only the local interventions, but also to try to achieve this objective of creating a culture where harmful drinking is unacceptable. So, for example, with this intervention, and this was a very small pilot, right, for a few months, obviously like basic mass communication channels were used, but they also, which I didn't have a chance to talk too much about, used kind of ambassadors in the communities to also kind of encourage engagement with this strategy. So there was a simplified logic model that was used to kind of think about how this could affect impaired driving. And so one of the opportunities for us as we move down this path to supporting a more diverse convening in this community is to think about what that looks like. That's a little bit more multifaceted, and whether this kind of intervention can make a more meet the objective of addressing impaired driving and also addressing broader public health goals. So each community is different, and I think that one of the things that the alcohol industry actually brings to the table in these conversations with these steering committees is some ideas around what kind of communication strategies and marketing strategies can be used for the purposes to actually reach people in a certain way.
Any questions from the audience? Comments? Yes, please go ahead, David.
The card is for $30. Who pays that?
So it was a $30 coupon that was for a round trip. It was a round trip coupon for $30. And what was interesting about this from the intervention design is that when AB InBev instigated this partnership, they had a partnership with Lyft that could be used to test this intervention. So they had put forward the coupons as part of that. One of the questions that will be raised as part of this convening is that the right amount for these kind of coupons? How can the coupons perhaps be used differently? How do you engage, for example, with responsible beverage service in the delivery of these coupons so you can use mechanisms that might be offered more as a deterrent in these kinds of interventions?
So it was Lyft that provided the $30 coupon.
It was the program that provided the program did.
Okay, I think everybody wants to go for coffee. But first, let's give a round of applause for Mrs. Santana. Good discussion. Thank you so much.